Hi, today I'm going to talk about medication safety. We're going to start out with discussing the 8 rights. First is the right drug, and knowing that to check the label, as well as check the order, and checking our patient's allergies. The next would be to make sure you have the right dose, confirming the appropriateness of it, checking the calculation. Drugs like heparin, weight-based, you'd want to know that. The right patient, making sure you're doing the patient ID on all of our patients correctly before that, using 2 identifiers as well as using barcode, the barcode system with the EMR. The right time, making sure that it is very specifically to that. Making sure if it's a stat, when to give those, and also when are the other medications too, the PRNs as well. The additional 4 medication administration rights would be the right route, making sure you have that, confirming that. Is it the IV maybe, IM, oral? Next would be the right reason, making sure that you're giving the medication and checking the rationale behind it. Checking the vital signs before giving that Cardizem, the cardiac medication, a beta blocker. Checking any lab values before administering. And a patient does have the right to refuse also. Right documentation. Real time, education, providing them and documenting that, and any other necessary information. The right response is the last one. The desired effect, looking at also the adverse reactions that the patient may have. What method should be used to provide patient education during medication administration? The answer would be teach-back. And it's very important to be able to provide the teach-back methodology with our patients and family. So one example would be you could do is a Lovenox. Patients aren't staying in the hospital as long. So that would be a great way for a patient and or whoever's going to be the one to be home with them to do a return demonstration on that and to be able to document that. What is required in the role of an individual administering medication? All of the above is correct. So next topic, talking about therapeutic interchange and non-formulary medications. No medication can be interchanged without pharmacy approval. For example, Lipitor being exchanged for Crestor. Prescribers may write do not interchange if they want to substitute the medication. It's important though also for the providers to communicate with the pharmacy on the medication as well to find out what we have in our facilities. Non-formulary medications require prescribers to contact the pharmacy department to arrange the order entry and procurement of that medication. Not readily stocked in the pharmacy can only be made available within 72 hours. What can the pharmacist help you with in regards to medication administration? They can do all of the above. So very important, you guys have such an important responsibility. Medication administration with patients is so important. Make sure you know why you're giving that drug before going in there, especially in front of the patient and the family. Know what the adverse effects are as well to be able to give that information when a patient asks you that. It will be one of the most important things that you do and part of your role as a nurse. Make sure you're assessing your patient. You must be alert to any changes in the patient's condition that could be affected by the drug therapy or further impact the patient's status. Know the patient's comorbidities and look at the lab results of the patients. Be alert to the serum levels for specific medications and antibiotics. What must be done when a patient brings medication with them to be self-administered? It's always important to make sure of this, right? Patients do bring in their own medication and they keep them at the bedside, so we need to make sure that these medications get sent down to pharmacy for verification and labeling, and also have the provider write an order for these in the EMR. Which of the following is true about medications taken during pregnancy? And the answer is medications can harm the fetus during different stages of the pregnancy. What criteria is important to refer to when assessing for appropriate medication use in the geriatric population? The answer is Beer's criteria. This is a list of medications to avoid for the elderly. So making sure that we always look at our patients and respecting their culture. This can affect what a patient and the family's understanding of drug therapy and other treatments as well. Every culture has their beliefs about health, disease, treatment, and healthcare providers. Also social factors, perceptions, and religion. So it's so important that we ask our patients what other kind of remedies or medications over the counter, vitamins are they taking. They have holistic remedies. So we need to ask these questions and having that documented for our patients. And we must respect and also educate our patients. The golden rules. Administer only the drugs the licensed healthcare provider has ordered. Always perform patient identification with every encounter and compare the source document. If you are unfamiliar with the medication and you have questions, you must communicate with the provider. Review your medications, your drips prior to administering. Ensure that there's a med reconciliation on the patient. Never leave prepared medications unattended. Never give medication to someone else to administer. Never take medications from another patient's drawer. Never override your Pyxis or your AccuDose and bypassing our pharmacy. Always calculate the dose carefully. Always prescribe to align with the patient's plan of care. Always perform good hygiene. Always prepare medications in a well-lit area. And always follow the correct process for medication administration, knowing all the 8 rights. What is BCMA? BCMA is Barcode Medication Administration. This is designed for the use of the healthcare setting to prevent medication errors and to improve the quality and the safety of medication administration. Where in the medication administration process do medication errors occur? They can occur in the ordering, with the transcription, the dispensing, and the administration. So CPOE and pharmacy integration and verification of medication orders have reduced errors in ordering, transcription, and dispensing. Every patient, every dose, every time. Medication administration errors have the potential to cause serious harm to patients. BCMA is being currently used at our facilities and to increase patient safety and decrease errors at the point of administration. It is a safety net at the patient's bedside which will protect the patient along with the clinical staff. Why BCMA? Barcode medication administration has been promoted to be most effective way of reducing medication errors. 35% of medication errors occur at the time of administration. So clinicians at the bedsides are the last level of defense in eliminating medication administration errors. So the BCMA, with us using this with our Sunrise, has validated 5 out of the 8 rights of medication administration at the point of care. BCMA is the extension of the EMR. A more detailed view of the EMR promotes the clinicians to scan, requires the appropriate supporting documents, and closes the loop on the process of medication administration. It is the safety net for you guys. It'll inform you and letting you know that that medication is not on that patient's list by saying it's not found when you're doing this. So the Northwell BCMA workflow, you're going to review the active orders in the order tabs and confirm verification they will be reviewed by pharmacy. Review patient EMR for medication that's due. Collect the medications to be administered to your patient and then proceed to the patient's bedside. After confirming the patient's identification, then you'll scan the barcode and the wristband. Scan the drugs that will be administered to the patient. Review the detailed information on the computer screen about the scanned med and acknowledge any required alerts or warnings. And then complete the scanning. Administer medication to your patient. And then last, select the medication given to complete the documentation of meds on the EMR. You'll also have the opportunity during a computer class to do this process. With the BCMA, and just making sure you're scanning the patient, look at the 2D barcode, the Aztec, making sure you have the right patient's name and date of birth as well, looking at that as a reminder, verifying that by doing your patient identification. And if the ID is not viewable or if it's smudged, you need to get a new bracelet and start the whole process with patient identification and putting on a new band on your patients. The what do I scan? So we're going to go over that on looking at some examples. What do I scan? The rule of thumb is to scan the manufacturer's barcode. Look at the actual NDC code on them. So we'll show you some slides and viewing some of the medications. So here's some further scanning and to show you the NDC code on this IV bag of heparin. Another example of what do I scan, making sure that you're going to scan the vial that has the NDC number that's attached to the solution. That is the preferred. Just another example of what do I scan. This is ceftriaxone. There is a NDC number that you'll see with the red arrow pointed to it. That's the area that you will be scanning during your medication administration. So patient safety goal, when in doubt, and if a patient says that's not my medication, you're going to stop. And then also, if you need to escalate it, please do so. Communicate and escalate. Now we're going to talk about medication variance. Medication variance. Any preventable event that may cause or lead to inappropriate medication use or patient harm that occurs during the process of prescribing, dispensing, administering, monitoring, or transcribing a medication. The types of variance, one is actual, which is it would reach your patient. Say that a medication that you were supposed to give IV and you administer it as IM. The other type of variance is a potential near miss, which you physically did catch it before it reached your patient during the administration of it. That you notice that it may have been the wrong dose. You know, it might have been an Ansab that was supposed to be 1 gram, and you notice it was 2 grams, but you didn't go ahead and administer it. That's considered a near miss. What is an example of a medication variance? It will be all of the above. Wrong drug, wrong dose, wrong time. Medication variance may occur as a result of which of the following? And remember to select all that apply. So it would be A, B, and C, which is lack of knowledge and training, failure to hand off, lack of prescription review. So let's review the actual variances of examples. So one is to failure to administer and order a drug. So that's an omission. Another one would be administering outside or predefined time interval. Wrong time. Wrong route would be the wrong route site for the correct drug. Unauthorized drug error. Administration of drug not authorized for that patient. Wrong dose error. Administering the wrong number of units, for example. Giving too many tablets of something. Wrong preparation of that dose. Incorrect preparation of the medication dose. Maybe it was supposed to be oral, but instead you gave it as an IV solution. So let's review the causes of medication variance. One could be education, the lack of knowledge and training, the poor drug calculation, making sure we are calculating it correctly, high alert sound-alikes, medications, prescribing errors. The other thing is the pressure of work. You guys get to work 12 hours, so you may work 2 days in the beginning and you may not work again, or sometimes you like to work 3 days in a row of those 12 hours. So the fatigue of that increased workload, distractions and interruptions during your work, failure to hand off, making sure you're communicating well between one handoff to the next when you're doing your patient handoff to each other. The system, the lack of prescription review, labeling errors can occur, so making sure you're looking at your labels before, again, administering those medications. Poor feedback following patient identification. Incident reporting not anonymized, and inadequate incident documentation. So let's review on the variance reporting procedure. So if an occurrence occurs, first is the variance, occurrence report, and then notifying your quality management. And quality is at all your facility sites. Investigation of it, and seeing the corrective action. And at the end, making sure you're developing that action to prevent further errors. And that happens at your facility. The team is a multidisciplinary team that talks it over. Sometimes you may hear the term root cause analysis. They evaluate and see what occurred and how to prevent it next time. They may change and update policies and procedures, so you'll be involved with that process if this occurs. It may include more than one healthcare team professionals. For example, it may include your providers, your pharmacists, and your nurses in looking at and reviewing what occurred in the situation and seeing the feedback and preventing this error for next time. What culture does Northwell Health promote? And is defined as a culture which seeks to identify and balance system events and personal accountability. At Northwell Health, promote a just culture with hazardous medications. This is new, and just making sure that you're able to be safe also during administration. So there's different classifications to know for these hazardous drug groups. One is considered antineoplastic drugs. A second category is the non-antineoplastic drugs. So just making sure that these could pose a reproductive risk. A third is the reproductive risk medications and knowing those drugs that will be classified. You can find the list of these medications under the Northwell intranet under the nursing practice link. So I just wanted to show you the slide on the waste and return process where you would dispose the medications on some of those that would be empty. So some of the medications, just looking at this slide, looking at the first one with the no waste alert, just taking a look, for example, if you had half a PPN or TPN bag, if there was still solution of that in there, that would go in the first portion of it. And you can read some of the other examples as well, making sure that your plain solutions, you would empty those, for example, saline solution, lactated ringers, you can put those into the sink. That would be not in the patient's direct room, but the room of where your housekeeping goes into. And anything that was totally empty, making sure you're taking off the patient identification of that label, and then you can dispose those that are empty IV bags, for example, into the regular garbage. If you have further questions, please contact your facility at your pharmacy if you have further questions on waste and return. So drug diversion. Drug diversion is defined as the diversion of illicit drugs for illicit purposes. So right now, this is an epidemic. Just making sure if you see something, please say something. Say something to your manager. If it's on an off time, definitely say it to your supervisor also, and talking about this. So drug diversion and abuse puts patients at risk for suboptimal treatment. Systems are in place to preventing, detecting drug diversion and dealing with employees who are battling this, prescription drug dependency, and selling drugs. We can actually and see this behind the scenes. They can run a report by auditing the Pyxis and reviewing the EMR. For those that are having drug diversion, there's an employee assistance program that is available for them. The Office of Professions would be reported to, and it is everyone's duty to report observed signs of impairment and diversion. Some final points. You must administer drugs safely and effectively, adhere by the policies, and follow the 8 rights of medication administration. We just want to talk about some practice changes to address intravenous solutions and other kind of shortages that could come up of medications. So sometimes there could be IV solution and fluid shortage based upon our manufacturers. Sometimes the hurricanes in the manufacturer areas have affected us in receiving enough IV fluids. Currently, we're not in a shortage right now of IV fluids, but the Northwell Health of a procurement has been monitoring this, and they'll let you know, as well as your sites. They'll inform you of any kind of medications that are shortages noted. And you can check with your sites for any updated information on shortages of any kind of solutions or medications that will affect your practice. We have now concluded the medication safety session, and now we're going to go on to talk about 2 case scenarios. Okay, let's look at the first video on the case scenario. View what you have seen and see which of the 8 rights of the medication administration was not followed.
Oh, here comes your nurse.
Oh,
Hi, how are you?
Hi.
Good. How are you?
I'm good. My name is Shobha. I'm one of the nurse. I'm just going to give you medications. Okay, how are you doing?
Okay, doing much better.
All right.
That medication looks similar to the one you got earlier today.
Yeah, I get so many medications. I have lost count of all
Oh,
of those.
sure.
Yeah.
What medication is she getting in that vial?
Oh, this is Solomidrol.
Oh, that's the one for your pneumonia, remember? The doctor said that it's for swelling or something, right?
Yeah, I
Yeah,
think so.
he said
But
it would
it's
help your
making
breathing.
making me feel much better.
Oh, thank
You
God.
see, I'm not
I can't wait to
doing
get
as
you out of
hard
here.
like before. So.
Yeah. And maybe she can go for a walk later. That was the plan of care, right?
Oh, I would love to
Oh,
take a
you
walk.
want- I have to double check, on the computer. So
Mhm.
let me give these medications first, okay, and then I go. Okay.
Okay.
All right. Let me scan. Okay. Can you just tell your first and last name for me?
Sure, it's Priya Singh.
Okay. Can you spell it?
Priyasingh.
Okay. And your date of birth?
March 17, 1969.
Okay. We have Priya Singh.
Maybe we can go watch SVU when she's done with your medication.
Oh, yeah, sure.
It's
I'm
coming on
waiting
soon.
for that show, you know.
Mm.
All
We
right.
love that show.
Oh, I love that show.
It's gonna be a little pinch, okay?
Okay.
Little pinch.
Okay.
That seemed like it hurt a little bit.
I usually get it through this. Is this something new that I have to get it in my arm today?
You said you get it through there?
Yeah, I always
No.
get it through my IV.
Oh no, what did I do?
Oh my God, is something bad gonna happen to me? I'm
Oh,
getting
God.
scared.
I'm gonna call my nurse manager and let the doctor know. We'll go from there. I don't know how I did this.
Oh my God, I'm so
God.
scared.
It's gonna be okay. Please fix this. This is
Please
a
call
big
someone
deal.
immediately. Please call the doctor soon.
So which of the 8 medication rights was not followed in this scenario? What was done incorrectly in this scenario? And what could you have done differently to prevent this error? What would be the follow-up on the situation? And also the last, how could we utilize team steps to have effective communication? So the thing on this case scenario was the wrong route. The patient received the Solumedrol as IM, but it was prescribed as IV. And during the time of medication administration, so many interruptions occurred, and as you can see from the scenario, the family or friend that was sitting there was asking many questions during the time. So just making sure that you concentrate during medication administration and following all the steps. Some other things that you may have noticed during it was that she wasn't wearing gloves, the hand washing was not performed, didn't check allergies, no barcode medication administration during that time also. So that would also have to be included during your time. Just making sure we're giving patient education as well during it. And things that the nurse in the video in this case scenario did correctly was she introduced herself. She also did patient ID with the source document. And next time, just making sure that you have everything in place using BCMA. And also in the follow-up of it, because it was given in the wrong route, an occurrence report would have to be written. You'd have to let your charge nurse, your supervisor, and nursing administration, and to complete that part in documenting it. Okay, so now you get to view a second case scenario and take a look in to see which of the 8 medication rights was not followed in it.
Hi, Mrs. Smith. Mrs. Smith, are you okay? Mrs. Smith, are you okay? Oh my God, Mrs. Smith. Dr. Jones, Mrs. Smith is not responding. I think I gave her too much of Dialogid. What should I do?
Okay, give her 0.2 milligrams of Narcan IV push, and then let me know if you need anything else.
Oh my God, okay, it's 0.2 of milligrams of Narcan IV push?
Yes, that's correct.
Okay, sure, I'm gonna go get it. Let me give this Narcan quick. Let me flush it. Oh, Mrs. Smith.
What did you do to me?
I just give you some medication to make you feel better, okay? You should be feeling good soon, okay? I'm just going to
This pain.
scan this medication.
Okay.
Oh no! What did I do? 2 milligrams per ml. I was supposed to give just 0.2. Let me go get my doctor and the manager.
So which of the 8 medication rights was not followed in this scenario? What was done incorrectly? And view what was done correctly as well. What could have been done differently to prevent the error? What is the follow-up in the situation as well? And what other team steps communications that you can utilize during this? And this case scenario showed that the patient had received quite a bit of a pain medication. It was dilaudid. The patient was unresponsive. So what would you think that you'd want to do? You know, if the patient's not responding, and I think that we would definitely call a rapid response. You can definitely to assist in the patient, definitely calling the provider as well and seeing what kind of medication that we could use, and in this was the Narcan. So making sure you do a check back, you know, and seeing that with the patient, with the provider, and making sure you're giving the right medication. And what was done incorrectly was that it was not the right dose. No patient ID was performed, making sure that you have a source document, making sure you check the allergies. Also, there was no BCMA with this patient, noticing that, so you would utilize that next time. And always stay with your patient for safety. And you're always, you know, definitely call that RRT, the rapid response, if you need to on the patient. And what the nurse did correctly in this case scenario was that she did have the right medication. She called for assistance, you know, and assisting with the patient that was not responding at that point. Making sure that communication is so important. So definitely, if you need that extra assistance, call the rapid response team at that point. And also, if you need to escalate it, you know, calling your charge nurse, calling administration if you need anything. Making sure you're communicating with SBAR as well during the situation that's there. And also debrief at the end of it.